Now, let's have a conversation about unionism in the health sector. We have in the studio spokesperson for the Union Professional Nurses and Midwives Ghana, John Agbenyavo. Thanks for joining me. Now, how are nurses and midwives coping with this COVID-19 pandemic?
Yes, thank you very much, Aisha. It's quite hectic to have this pandemic, having to deal with it every time you go to the hospital. In fact, since last year, March, nurses and midwives have not rested. We have been on the run up and down just to ensure that the general public is actually in good health. And whilst we do that, there is a need for us to also ensure that our welfare is well taken care of. And that is a responsibility of the unions that are within the fraternity, such as the Union of Professional Nurses and Midwives. So it is important that as a nurse and midwife, you should belong to a certain union that will actually put your welfare first, because you don't know when another pandemic will come, which will even be worse than the COVID-19. So yes, nurses and midwives are doing well because the Union of Professional Nurses and Midwives have actually put in some measures to ensure that their welfare is well taken care of.
Does the labor union one belongs to the, do they determine the salaries or the salaries that people get? I mean, those who are part of your group, do you determine the salaries that they are paid?
Yes, so one of the responsibility of a union is to negotiate for salaries for workers, the group of workers that belong to that particular union. So the Labor Act is also clear on that, and then the labor regulations also clear on that. But then at every point in time, it's only one union that can actually hold a bargaining certificate. And once that happens, it binds all the professionals regardless of the union that you belong to. Labor Regulation 10 is clear on that. You mentioned that once the certificate is given to one union, that union has to consult other unions before they go for negotiations. So yes, we all have to come together to negotiate salaries for nurses and midwives. So it's the responsibility of unions. So it doesn't matter where you belong. Once you are a nurse or midwife, you are supposed to take the same salary that any other person takes, regardless of the union that you belong.
Let's talk about bargaining certificates.
Yeah.
Now, without it, does it make a labor union less of a union?
Not at all. Bargaining certificate is actually called collective bargaining certificate. So it means that it's actually collective for all workers under that particular certificate. So the chief labor officer cannot issue certificate to all the unions within the same professional body. So the law is actually clear on that and has made provision. So all the unions cannot get the certificate at the same time. So once one gets it, it binds all the unions. So it does not actually make any union less of a union. And then it also means that once the one with the bargaining certificate is called for negotiation, they are expected to also invite the other unions within the same professional body to also join hands so that they can actually negotiate for the entire profession. So it actually does not matter.
Okay, but we've had to, we've lost some health professionals throughout this COVID-19 period, and you've indicated that you are overwhelmed with the figures. As the figures drop, I mean, we're seeing a little relief there. How would you describe the general situation of the welfare of midwives and nurses?
Yes, we are doing well in the sense that there are some packages that are available. I remember when it started, the government actually gave some reliefs to nurses and midwives, and then it has been taken off, unfortunately. So I would want to use this medium to ask that the government restores that, because we are still battling with that. But nonetheless, because of that we have envisaged that things like this will happen, members of our union are not worried, because we have welfare packages for them, we have insurance packages for them. Once you fall sick within your professional domain, you are taken care of. So the welfare generally, I would say it's okay, just that our pay is not actually commensurate with what we do. But then the problem is that if you don't belong to a union that actually thinks about your welfare, you have such challenges. So that is why it is important that you choose the union that actually thinks about your welfare, because for government salaries and all that, it will be paid. And it will be determined by the government anytime. No matter how strong you are at the negotiation table, government will always have their way. So the understanding is that you should be able to belong to a union that will think about your welfare aside your salary, because for that one you cannot do anything about it. Okay.
I'm grateful that he joined us. He is John Agbenyafo, and he's a national PRO for the Midwives and Nurses Union, right?
Yes, Union of Professional Nurses and Midwives.
I'm grateful that you joined us, and wish you all the best.
Thank
and we're
you
still
very
live
much.
on the Pulse.